And welcome to another episode of Postpartum Connections. I'm your girl Tashia, and of course I have another special guest with us on today's episode, Miss Esther. Thank you so much for being here with us.
Oh, thank you for having me.
Absolutely. So on this episode, we're going to be talking about breastfeeding during this postpartum journey. So I have Miss Esther Singleton. She is a registered nurse, an IBCLC, a certified lactation educator, and a parental educator for over 30 years of experience in maternal, child, and breastfeeding. Wow, you've been in this game for a while, huh?
I sure have. And
Awesome.
love every minute of it.
That's right.
Yeah.
You gotta have a passion for this. She is a wife and a mother of 2 sons and 3 granddaughters. She enjoys spending time with her family and having long walks on the beach. Oh, I love the beach. So serene. She has trained thousands of childbirth, lactation, and parenting education, while also creating a community-based programs that promote health and wellness for families. Esther currently serves as the Florida Department of Health Broward County WIC Breastfeeding Program Manager. She's also the president of Broward County Breastfeeding Coalition and the past president of the Florida Breastfeeding Coalition, perinatal educator, and she's also a faculty of the Kappa CLE program. She was awarded the Gold WIC Loving Support Award for excellence for breastfeeding support and practices, and the Certificate of Appreciation from the USDA in 2015 and 2020. Congratulations.
Thank you.
Yes. With Esther's leadership and management in 2016 through 2024, NACCHO was recognized. NACCHO recognized her and the Florida Department of Health, Broward County, the WIC Peer Educators Program, as one of the model community practices in the area. Man, doing big things in Broward County. That is beautiful. She was able to successfully provide diversity for peer and professional-led lactation support services, which increased breastfeeding rates in the community. And in her private time, she is devotional who believes in a deeper part that plays during her time here on the planet. Awesome.
Yes.
Awesome. Wow, you have done a lot of work here in Broward County. I love that.
Yeah, thank you. Hearing this, I think, wow, I have done a lot.
Yes.
You don't think about it when you're in the motion of making pathways and doing things for families.
Absolutely. And I remember, being able, sitting on the coalition, and when you were rolling out the practices in the workforce and making sure that the offices and the businesses had the workspace for working mothers, to have breastfeeding spaces for them to being able to pump. And then also the child care centers, that was like a whole big initiative too, which was huge. And then the peer support, the peer educators, being able to find moms in the community to support each other through WIC.
Yeah, it is awesome. So again, listening to you as you describe it, and putting all that time and effort, because when we talk about breastfeeding, we talk about duration. Like first we start really with initiation. Like how can we get all moms from all backgrounds to start breastfeeding? Right. So we realized that we need a community to do that. It's just the same concept as that we need a community to help raise a child.
Absolutely.
So we need community efforts to come together so that we can create programs that are sustainable in Broward County. So Broward County is unique, and it's especially dear to my heart.
Absolutely.
So that we say WIC is a huge part of it. The community hospitals, we know the Healthy Starts, the community programs, healthy families. We know, all of Urban League,
Yes.
all of the diversities in our different communities coming together for one initiative, and that is to have a stronger Broward County breastfeeding community. So it makes a difference. And you spoke about WIC, moms who have breastfed their children. So what a wonderful idea to give this opportunity to those moms to come in, train them how to help other mothers.
Absolutely.
And so not only that, it's a diverse group of mothers coming in, whether you speak Creole, Spanish, Portuguese, and whether you speak English from that background. And so they're trained to help each other. It's a wonderful concept. I think you couldn't get any better than that.
Absolutely. And being able to lean on each other, which is, parent connection is something that's very dear to me, because I'm like, this is us parents connecting with each other, growing with each other, and being able to be able to share and learn and then support, because like you said, it takes a village, right? So it's definitely a beautiful thing. So what made you want to do this work? You're an RN, IBCLC educator. Tell me, how did you get your start in this?
I know my journey. I share this with those who I train, because I still train, and those who want to be lactation educators. So I got started in this because of my own personal issues. So having and actually I have given birth to 3 sons, and so I know that the bio speaks of 2, but having my sons and then running into my own personal difficulty when it came to breastfeeding. And as a nurse, I worked at that time as a nurse in the hospital in the NICU, at that time, neonatal intensive care unit, and I couldn't find anyone consistently, I want to say, to give me that support that I needed. So I was having the same issues that a lot of the patients, and we call them patients or clients from WIC, that was having. So I would go to, maybe a colleague, I'm not going to name anyone, this one, that one, to help me. And they were all like, well, why do you want to do that anyway? If it's that difficult, just give formula. So what's your problem?
Right.
So not understanding, and on their behalf, they didn't understand.
And this was you as a NICU nurse.
As a NICU nurse, yes.
Having your sons as a NICU nurse, trying to breastfeed and really trying to figure out, okay, where are these resources to support me?
Right.
Wow.
Exactly.
Wow.
And they were none.
Wow.
So that's how I got into this on this journey, I say. And so it took me saying, okay, wait a minute, there has to be more to this. I have a mom, and she was helping me, and she did breastfeed too. So that's another rarity when it comes to history of women of color breastfeeding. But she did, and so she can give me encouragement. But at the same time, I would have, on my other end, I would have mother-in-law who would say, what are you doing? Just like everybody else, forget this thing with breastfeeding. So I
didn't understand it.
No, did not understand it. Did not understand the benefits for breastfeeding for moms, baby, society, all those health. So I actually took myself to Baptist Hospital, and where they had an IBCLC and a nurse IBCLC, and then I just spent some time with her. Then I realized there was such a thing called International Board Certified Lactation Consultant. So then I spent time studying, preparing. Then I spent volunteered at different hospitals, clinical hours, because you have to have that also in order to sit for the exam. And then the short of this long story is then I took the exam, passed the exam, and then recertified since then multiple times. But that's how I got on this journey, because of my own personal issues. And then I said, there's something to this. I can stay on this journey and educate, teach, and help others. And so I made it my life passion.
Nice.
Yeah.
So that's a beautiful thing. Nothing like your own story to catapult you into being able to pour back into the community. Because as a mom, that's something that you're giving others what you didn't directly get right away, which is a beautiful thing.
Yeah. So thank you for that.
Yeah, absolutely. Absolutely. So you spoke about the benefits. So what are the benefits? Tell our viewers and people that are wondering, and then, for our grandmothers and grandfathers, okay, what are the benefits for breastfeeding for both mom and for baby?
Yes. And so I like to divide the category up and say, okay, well, we talk about the benefits for babies. And so, we know, and sometimes we don't know, that it improves their immune system. So when we talk about the immune system, we're talking about a whole category of everything. So the respiratory, right, the GI tract, improving the digestion, improving also, we just talk about the auditory, the anatomy of the oral cavity, the alignment of the teeth, and we go ear infection, decreasing the incidence of.
Right.
So when babies are taking mother's milk, so we look at the incident, the number and the percentage of decreasing the chance of having a chronic ear infection, chances of having gastrointestinal, whether it's Crohn's disease, irritable bowel syndrome, all of the things that we hear about now in adult life.
Right.
Decreasing those incidents of respiratory infection. And then we talk about the increasing the IQ, the brain development. Then we go on and on and on about babies' benefit, decreasing the incidence of diabetes and incidence of certain types of cancers. So it goes on and on and on.
And this is all for baby.
This is all for
the
babies.
baby.
Just putting it under that category.
Yeah.
Just for babies.
And this is long term, because you're speaking of things that come up later in life,
yes.
The older we get.
Yes, and research studies have shown that. So we look at it and say that if a baby received mother's milk exclusively for the first 6 months, about the first 6 months of his or her life, then those ratios and those percentages increase the benefits and the effect on the rest of their lives. We're talking about the rest of their lives.
Wow.
Long-term studies have really found this to be the case. So that's all on babies. And then we go to moms. It's like, okay, we can't, moms, we know about bonding. Everybody talk about holding and bonding and loving your baby and babies loving you back. That is true, and that does happen. However, moms get so many more benefits. The decreasing, again, the incidence of breast cancer, osteoporosis, all of the long-term cardiac disease, vascular disease. The longer she breastfeeds, the greater the benefit, the greater the bang for the buck. Okay, the uterus returning back to normal, decreasing the incidence of the bleed out. We talk about an epidemic in our country of where moms are, having hemorrhaging. So that decreasing that incidence. And then it just goes on and on and on too for moms. So the longer she breastfeeds, the greater the benefits.
Greater the benefits.
Right.
Wow. So it's the greater the benefits not only for the mom, but greater benefits for the baby. And then in turn, greater for the benefits for our community.
Yeah,
right?
That's what I like to say for our society. And then I also like to say the greater the benefits for the partners. I don't like to, I always include them.
Yeah,
because
absolutely.
these benefits are great.
Yeah.
Because we're talking about it also decreasing the incidence of health. Illnesses, I want to say, increasing health, decreasing the illness factor. So you don't have to go to the doctor often, pediatrician often, mom's issues, going back to work as we mentioned briefly. So she doesn't have a baby that is sick as much.
That's true.
So she doesn't have to take off work. So now the government benefits.
Right.
Now the employer benefits.
Yes.
So it goes on and on and on and on.
So
right, exactly.
Right, absolutely. Absolutely. So how can partners support? You brought the partners into the conversation. How can they support and feel involved? Because I feel like sometimes they're just kind of like, I don't know what to do. Like everything is just mom. Everything's mom. So mom carries the baby. Baby comes out. Mom has to feed the baby, right? And so I recognize sometimes there are a lot of parents who's in this like limbo of, all right, well, you're doing everything anyway. So what am I here to do? Is that necessarily true? Or what can you tell our viewers and our partners? Hey, look, you're important in this process too.
Absolutely. I can echo those words that the partners are important, very important in this whole process of parenting and in breastfeeding support. So even from the beginning of that encouragement, so we all need encouragement throughout our lives in this different situation, and moms are no different. So after they're laboring in birth, and they're receiving those encouraging words, they also need the encouragement from their partners. And guess what? Babies have to eat around the clock. Partners are there to now help moms, whether it is preparing a meal, something to drink, whether it's having that special bonding time with your babies, whether it's taking the baby and singing and reading and massaging. So creating that bond, father, partner, baby bond. That's what we want to create. And so it's very important that partners realize that no. You need to be part of this journey, and we welcome you to be part of it.
It's a different role, right? Just because you're not feeding doesn't mean that you're not bonding, right?
Absolutely.
You know? And then teaching the partners. I know in the hospital, I try to teach the partners, like, hey, you remind mom of these things, like when we're talking about breastfeeding and the feeding, and then when it's in the middle of the night and then she may be struggling, and you can come in and say, hey, remember, make sure baby's mouth is open wide, or let me help you support your breast and get you some pillows and things of that nature. So that's also definitely a good thing.
Yeah, and let me just share a little story, because I think about this, and this is why this smile on my face. Because I was speaking with a couple not long ago, helping them with their breastfeeding situation. And the phone call that I received from the Heritage, it was the father who actually called on behalf of the baby's mother. He wanted to say, this is my role, and I was asking him the questions while I was talking to him. Who called? Whose phone number? He says, my phone number, because I'm doing my role. My role is to make those phone calls. My role is to make sure the baby's eating, she's eating. So that's why I'm calling. And so I was communicating with him.
With the dad.
With the dad, right?
I love it. Yeah.
And he, in turn, was allowing mom to rest, allowing mom to nurse, but he was taking that active leadership role in this whole dynamic. So that's very
beautiful.
Unique. Yes.
He's like, this is my role, okay?
Right.
So I'm communicating with you. This is what we need.
Right.
So when can you come?
Exactly.
I love that.
Right.
I love that.
So
That's a beautiful thing.
Yes, it is.
Yeah,
yes, it is.
Some people can get that confused, and it's not necessarily overbearing. It's literally providing the support, which is necessary. Because now mom is relieved that I don't have to remember all of this, Absolutely.
And then he's downloading. See, this is the app where the baby. I was like, okay. So he has the app of the feeding and the diaper changing. All of that is cool. That was so
beautiful.
Cool. Yes.
That is amazing. So what is the biggest challenge that you see when seeing the families when it comes to breastfeeding?
So some of the biggest challenges, I want to put an S on that, because a lot of times we see moms, and especially myself and the families, and so that lack of confidence. So one of the things is the confidence. Am I doing this correct? Is my baby getting the amount of milk he or she needs? Because they're not able to measure it out.
Right.
So now it's teaching to watch the signs of the baby being satisfied. And the frequency of feeding, and then watching the output with diapers, the bowel movements and the pees. So it's like re-educating or educating for the first time, so that we help her build that confidence, help them build the confidence. And then the other one is sore nipples. Sore nipples is still one of those, maybe, perceive, or they may be, I think I have sore nipples, I think it's gonna hurt, or it is that it actually does hurt. So it's latch on, the way the baby is latching onto the breast.
Got it.
So it was latch on, confidence, and engorgement. So engorgement happening, milk is not transferred, not being removed, mom's not understanding that they need to nurse, or with a decent pump, not talking about any brand, that they need to use to remove the milk. The colostrum, the milk that's coming in. Right.
And a lot of that is when we're talking about that engorgement, that leads back to the latch too, right? Because of the transfer, the way the baby latches and how the baby latches on. in order to transfer the milk out of the breast. Yeah, that's huge. Sore nipples is real, and I every time that I was taking care of a patient the other day, and she was on the phone, she goes, "Oh, I'm about to start breastfeeding." She goes, "Oh, all right." The person on the phone was like, "Okay, girl, it's gonna hurt, but I'll let you go." And I'm like, "Oh my goodness." And I said to her, I was like, breastfeeding is not supposed to hurt. I said, if you are having sharp pain or pains, then that means the latch isn't right. I said, so we're going to work through this.
Right, exactly.
Because that's the perceived notion that breastfeeding hurts. And the amount of people, thinking about yourself, right? The amount of people that were in your position that probably didn't have any type or doesn't know where to go directly. And they put that baby on, and it was just, they were tearing up their nipples or what it may be. And they're like, "Oh no, this hurts, I'm not doing this. This is this." And then that is the constant conversation. So your friend gets pregnant, your sister gets pregnant. "Oh no, girl, don't you breastfeed because that hurts."
That is right. And that's why it is, you're exactly right. It becomes that story that gets passed down from generation to generation, from friend to friend, and just goes on and on. So one of the things that we definitely teach in our trainings, I do, is that it is not supposed to hurt like that. Yeah, there may be some uncomfortableness in the beginning, but that fades and that should go away. So we talk about that, and we talk about how to latch appropriately, and then how to get help. And you're right. And in our community, we're fortunate because we have that network of support. And I want to start out with saying the network of support after they leave the hospital. I know hospitals have phone call support. They may have support groups. So does WIC have support group. It does Heritage, Healthy Start, fund a lot of programs that support breastfeeding.
Absolutely.
And so we are so fortunate. Home visits that happens to help clients out when they're in need of lactation support. Absolutely. And that is so unique because that's not in every community.
Absolutely. So speaking of the hospitals and the birthing process, well, let me back up really quickly. You had mentioned the signs of the babies and knowing how to know that they're satisfied, right? So how can we tell the difference between are we just pacifying or are we actually feeding? So what are those signs of satisfaction that our viewers need to look for when they're feeding their children?
Okay, so when we talk about the baby being satisfied at the breast, and so everybody wants to know how much time. Do I do 10 minutes, 15 minutes?
Right.
So we're going to talk about recognizing the baby's behavior. And so once the baby is hungry, we know that behavior, and most of all, we teach moms to try to get the baby attached, latch before the baby starts screaming and crying, because that's the last part of hunger, sign of hunger, and it's very hard to get a baby to calm down, latch, and feed. So recognizing those hunger signs, whether it's smacking the lips, whether it is opening the mouth, moving, mouthing, all of those signs, stretching, and just all of that, and then get the baby to latch on. So now the baby is latched on correctly, and the baby is nursing, and the baby, now moms hear the milk swallow, the suck, swallow take place, so she knows the baby's transferring milk because she can hear it. And then all of a sudden, then the baby is relaxed. The body just relaxes, and the baby's hands relax. So now the baby is nursed, maybe one side all the feeding, or maybe both, but the baby now is relaxing, and she's hearing that suck, swallow, so she knows the baby is transferring milk. And then the baby may start to move and adjust its body a little bit. She takes her off, and burps, and there's the burp. And maybe not. The baby may not burp right away.
Right.
So we're watching the behavior, we're listening for the swallow, and we're, the baby's relaxing. And timing is part of this too. So that's how we work. So now when we talk about pacification, I like to say this to the audience too.
Right.
Breastfeeding is I want to say, how do I put this? It involves several aspects of the baby's development. Yes, it is feeding, but it is also sucking, pacification, and development. So oral cavity development. So therefore, you're going to have some pacification that happen throughout the feeding itself. Right. So it's not So, watch a baby, watch mom in the dynamics and understand, yes, there's feeding, but it's like, okay, now the baby stops at this, I'm going to cut him off at 10 minutes. I'm going to cut him off because that's all he or she should get. But, now we got the pacification, but we also have socialization. Baby is socializing with you, looking in your eyes, your eye-to-eye contact, bonding with you. So now we got all that going on.
Okay.
So we allow that process to happen. And so then, baby falls off, detached. It's time now.
Got it. So that's not necessarily a bad thing if there's some pacifying that's occurring at the breast.
Right.
Okay.
It's not such a bad thing.
All right. I love that. I'm gonna switch gears just a little bit. Does birth affect the breastfeeding experience? How you bring your child earthside? Does that affect the breastfeeding experience?
It does, and it can affect the breastfeeding experience. And so, first of all, automatically I'm thinking about, at the time I would be in the labor room at this point in time, how we prepare moms for inductions or how we prepare moms for surgical birth. So that means that we're bolusing them with a lot of IV fluid. Yeah. That means that their breasts and their whole body is going to be limited, so swollen. That means the compressibility of the breast may not be there for the baby to latch on and hold. So the baby may go on and have a difficult time latching and staying. So yes, that whole process until the mom is diuresing and getting rid of some of that fluid. Right, and so that's where the reverse pressure
softening,
come in too, to help out. So yes, that can happen. And then, traumatic birth. So if mom is bleeding out, if mom, that also can have something, a relationship with the milk and the colostrum and the transition. So that may affect medications, of course. If a baby if mom has received the medication too close to the delivery, certain narcotics, and then baby is sleepy, baby is not responding. Right. Of course, we give medication to counter that, give the medication to the baby to counter that, but still that baby may be sluggish, so it may interfere. So we got several things that may interfere with the baby's breastfeeding experience during the labor and birth process.
Gotcha. But is that a end all?
No, it's not an end all be all. So we tell moms to hang in there, get that lactation consultant in the hospital to work with you, or the breastfeeding nurse is what I like to say, to help you latch the baby and help you do the reverse pressure softening, help you nurse. And actually sometimes we have, we didn't mention that, but surgery. So we may have augmentation of the breast tissue, and so you need someone to be able to determine if there's openings, pores in the nipple that will allow the milk to transfer. Sometimes we don't know that. It's a wait and see type of observation when it comes to augmentation. So we got to follow that.
And then also that depends on the surgery too, right?
Exactly.
Because I feel like there should be like more of a wave now of these surgeries happening where they're better at not cutting through the ducts at this point.
Yeah. And it's still, because the new research tells us that we don't have as many ducts that we thought we had before. So we got to say, moms, if you got to consider this. So if you're thinking about this surgery, please do your research. Please talk to the surgeon, because we don't have that many ducts. And so if the nipple is removed, if the area is manipulated too much, you may only end up with 2 ducts with an exit route.
Got it.
Right. So it's a lot to consider, but it doesn't mean that it's an end-all, be-all. Let's just work around it. Get that nurse to help you, get the lactation consultant, and that's where the follow-up. And that's why I say in this community we're fortunate because we have all the dots that can connect, from the prenatal to the post, and then for the home. It's wonderful.
So do you feel like prenatally there should be you should definitely take a breastfeeding class if that's your intent is to
I
feed?
think so, yes. I do think so.
Does that set you up better?
I think so. And I think the breastfeeding classes should be focused on solutions, on some of the prevention, in case of. So we talk about benefits. So, and it's wonderful because not everyone knows all of the benefits, and I just mentioned a few here. So we can talk about that. Do I think the class should be focused totally on benefits? I think the class should be enhanced so that we're giving the moms a plan. So I like to talk about, we talk about the birth plan, birth preference plan. What is your feeding plan? Your feeding preference plan. So that, okay, these things may happen, not to scare anybody, but how do you resolve them? With the engorgement, we're nursing, okay? We're latching better. Where is your resources? Who are you gonna call in the middle of the night? I say in the middle of the night.
Right.
Who are you gonna call? What girlfriend you gonna call? What is your girlfriend's name that you're gonna call, or your sister in the middle of the night? Because it's gonna happen. You know, moms who wake up and we're like, oh, what's going on? I'm so full, I'm so engorged. What's gonna happen? So
or you have pain at the breast as you're looking down. I'll never forget. I'm breastfeeding my son, and I'm like, why is this hurting? Like, what is happening? Dead tired, sleeping, and it's just kind of like, you know, and it's different because you're in this world, right? So I'm thinking, I'm in this world. I know how to do this. This is not my first rodeo, but I'm like, this is so. Why is this hurting? You know, he wasn't opening his mouth.
Yeah. And that's exactly it. I'm saying, I'm going through these problems? I'm a nurse. I'm a NICU nurse. I should know how to do this.
Yes. Absolutely.
I know. It should, right, exactly. So, yeah, so we have all of those, you know, so that's what I believe in a breastfeeding class.
Okay.
You know, we started out, and I did too, you know, talking about benefits, talking about this and that.
Yeah.
But then as the years passed by and I have seen moms after the class, after delivery, I realized if they knew some of the important points, how to get started and be successful up front, then they could also help themselves troubleshoot and know what to do. And so that's when I start changing what I teach and how I teach.
Gotcha, which is important. So not only have you your birth plan, you got your postpartum plan, but then you also need your feeding plan, right? And that's intertwined in that postpartum plan. So that's a good point, because you have to have some sort of like roadmap or somewhere to look to say, all right, this is if something comes up, these are the resources that I have. This, if something comes up, this is what. Let me remind myself. Oh, this is what she said to readjust, or how to readjust within that experience.
And then I want to add this other point too about the classes, that we need to invite the partners, and even grandmoms. So, you know, like I'm a Mima.
I love that.
A Mimi, a Mima.
Yes.
So we need to invite them also to classes, because it doesn't matter, you know, because we have to realize some of our roadblock or some of our issues with moms not breastfeeding and sustaining it can be from the partners and the grandmothers who say, well, wait a minute, honey, you don't have to do this. I didn't really do it. You know, I didn't have milk. You're not going to have milk. And that is not genetic. So people are saying those things just like sore nipples. They're not genetics. So we need to invite them to classes and support groups so they understand the process.
What the process.
And their role.
Absolutely. And then the importance of it, to where you're not necessarily like guilting the parents when it comes time to, I've heard a lot from a lot of parents, I can't leave my baby with anybody because I'm breastfeeding, or I can't breastfeed because I plan to go back to work, or I won't be able to have any help with them. You know, what am I going to do when I leave, and things of that nature. And that's something that was said to me on several occasions because of how long I breastfed, and I'm just like, no, they'll be fine. They'll be fine. There's nothing. You don't have to worry about that, because you know, once you schedule, you start pumping and things of that nature. So. That is definitely a good point, in being able to invite the whole family.
Invite them. They're very crucial in this journey of success. Yes.
Absolutely. So pumping. What are some tips and tricks that you want to leave for the parents when it comes to pumping and storing milk?
Okay. Well, when it comes to pumping, and I know that, first of all, I'm going to say this, in the very early stages, moms, you don't need the pump. Just use the baby, unless you're separated from your baby. The baby may be a NICU, maybe there's a health issue going on, and you need to use a good pump. Not going to name any particular brand on this podcast, but you need to use a decent pump that does not hurt, that actually pumps and cycle and suction the way a baby does at the breast. And a lot of your insurance companies will provide you with choices, and you do your research on the pumps and actually, secure the pump that you find best for yourselves. So first, work out nursing, breastfeeding, latching. Work all of those kinks out first. And if you have the time, because you're going back to work or school, then try to place the pumping part of your plan in addition to breastfeeding. So you're not going to stop breastfeeding and start pumping. You're going to continue your feeding at the breast and then start adding in maybe 1 or 2 pumps in addition a day, and start storing up that milk. So you're going to spread it out. You're not going to overwhelm yourself. You're going to try to pump again and around the time that you have fed the baby. And some babies will feed on one breast and mom may pump on the other breast. Right. They may choose to pump early in the morning when their breasts are full. I don't know if you remember waking up and going like, oh my gosh.
Need some relief.
Exactly, exactly. And so the baby will nurse, and then you will pump and you will store that milk. And the storing guidelines is based on what we use as the CDC recommendation. So you follow those guidelines on storing your milk, whether you're storing it in the fridge, whether you're storing it in the freezer, or even if you happen to have a deep freezer in South Florida, you can store your milk longer. So that's my takeaway, is that first, don't overwhelm yourselves. I see a lot of moms who they have the pump already there. Okay, now I'm breastfeeding, but now show me how to use this pump. And the baby is 2 or 3 days old. That's not necessary unless, again, you're separated for your baby or there are some other issues going on. And then we'll use a pump to evaluate that. But first, breastfeed. And then let's talk about pumping later.
Got it. So there's also, you spoke of like any medical issues and then separation. What about gestational age? Is that something that we need to be worried about too? Because I notice sometimes depending on the lactation consultant, we're looking at, okay, if they're less than 37 weeks, pumping needs to start sooner. If you have twins, pumping needs to start sooner. And then even the latch, right? So if the latch is not going well, then pumping should start sooner. Is that something that we should be looking into as well?
Yes, and that was a great question, the great examples too, to go along into the 2 categories that I had just given. Okay. So when we talk about the medical and then talk about gestational age, because we know that the baby suck swallow maturity comes in at the last stage of pregnancy and maturity. So if a baby is born 37 weeks or less, that baby will probably have some issues with the suck swallow and maintaining body temperature and all of that. So what we do is we work up a specific plan for that baby. And yes, helping the mom out is pumping. So the baby may be skin to skin, kangaroo care, what we do, that bonding, and then the mom may pump because the baby is not able to suction, stay, and actually maintain his oxygen or her oxygen saturation, and some of the respiratory distress may kick in. So therefore, yes, we're going to pump in those cases. And then that's gestational age. So we're also, you mentioned at the gestational age.
Multiples.
Yeah,
we also have multiples.
Multiples, yes. So if multiples, here's the thing with multiples, if they're not compromised with gestational age, they can nurse at the breast, both of them at the same time. So you just help mom, you're gonna get some help. You're gonna get some help to position them at the breast, and that you're gonna nurse them at the same time.
Gotcha.
Now, if that's overwhelming for you, we may come up with a plan where you're nursing one and you're just rotating them. But multiples, you should be able to nurse at the same time.
Got it. How important is the phalange size when it comes to pumping?
That's my new favorite topic.
The phalange sizes.
New favorite topic, because it is very important.
Okay.
And very important. This is a discussion I have a lot with all the clients I see. So the flange size, and unfortunately, and maybe fortunately, I can't say that because the pump companies send a standard size to all moms. and those sizes are usually huge. And for some moms, and then it may be too small for other mothers. So it does hurt. So the flange pumping should not hurt, just like breastfeeding should not hurt. And so we have measurement tools that we use to measure the nipple and compare it to the flange size. So that inner circle that measures where the nipple goes, that flange should fit where there's an easy suction in and out, release without pain. So when it's rubbing, it's too small. When it's going, it's too large. So so that tool that we use help moms to determine the size of the flange.
Gotcha. All right. So we gotta get the right flange sizes, ladies.
Yeah.
That's very important. So how do we overcome like challenges such as most moms or just not even like even if you have out of hospital births or in hospital births, how do we overcome weight loss? How do we overcome the low sugars? How do we overcome anatomy? You know, whether it's the baby's anatomy, tongue ties, or mom's breast anatomy, when it comes to this breastfeeding journey, how do we overcome those challenges? How do you help those moms?
Yeah. So helping those moms, they're gonna need this. Moms, you need the support to overcome the weight loss. So babies lose weight. They all do at the birth. There is a certain percentage that is a caution that the pediatricians, if they lose beyond this point, that we have to watch. It's an alert because the baby is losing too much weight. So we want to evaluate the transfer. Is mom, are you making the milk? And does baby have the ability to suck and release and transfer the milk from you to himself or herself? So that's what we want to watch for. So that may be a pre and post weight check after the breastfeeding, before the breastfeeding and after the breastfeeding. So that may happen there, but it is crucial that we talk about that and we watch that. Right. And so moms will be taking babies back to the pediatrician for weight checks, or they may have a consultant coming to their home to do the pre and post weight check. So that's one of the things. And then the other one you mentioned,
like low sugar.
Low sugar. So blood sugar is important, right? Yeah. We all know that.
Yeah.
We definitely know that from the hospital.
Absolutely. Yes. I see it all the time. It's like, we need to get formula because this blood sugar is low. And then, you see the look in the mom or it's just kind of like a defeat almost. It's like, well, no, I wanted to breastfeed. This is what I wanted to do. Yeah. But then the breastfeeding is not securing that sugar. How do we combat that?
So here's the thing. When I was working in the hospital, a lot, when I was a lactation consultant in the hospital too, working in different hospitals, those moms who had the babies who borderline gestation or the baby who was sluggish. And so understanding that colostrum is full of carbohydrates and protein, understanding colostrum will stabilize that blood sugar better than anything else for most babies. Now, we have babies who are born, they're septic, they have other health issues that will affect the blood sugar. So I'm not talking about those babies. I'm talking about in general. So that using mom's colostrum is the key. So can you pump it out? It doesn't work with a pump. Hand expression, it works. Long as you master how to massage that breast and get that colostrum out, then taking that colostrum into a syringe and just feeding that around the baby's mouth and the baby's cheek and letting the baby suck on it will stabilize the blood sugar.
That's true. And I noticed that hand pump works wonders with that colostrum at times because of that hands-on pumping, so to speak. You notice a difference between putting those breasts on the electric pump as opposed to that hand pump when it comes to the colostrum.
Yeah, when it comes to colostrum, absolutely.
The hand expression, you get a lot more out with that hand expression than you do just setting up with the pump.
Right, and we know that blood sugar is going to be monitored in the hospital based on a lot of factors. the newborn. But like I said, as a consultant, when I saw those babies that was at borderline or at risk, my plan was always is to extract the colostrum, hand express the colostrum, and then have it in a syringe and just feeding it.
And just feeding it.
To the baby. And teaching the parents how to do it. And then those blood sugars, when they rechecked, they was normal. When they rechecked, they was normal because they had the ingredients to stabilize it.
Right, and that's a good point. You know, you talked about that colostrum being packed with carbs and protein. That's huge.
And all the other wonderful things, because it has all the other immunity factors.
Of course,
you know,
the antibodies.
Yes, exactly.
Which makes it so potent and necessary for the growth and development. So that's a beautiful thing. What about anatomy? How do we overcome those anatomy? You know, flat nipples, inverted nipples. Like,
I know.
These, some moms, they come in and they're ready. They're like, all right, or even sensitive. That's something that I've come across lately. Sensitive nipples. We see that. I see that a lot lately.
Yes.
How do we overcome those?
So the anatomy part first. It is, a lot of moms also think they have flat nipples too. So we teach, that's one of the components in prenatal classes, to teach moms how to examine their own breasts. To teach them how to determine if they have flat or inverted nipples. Because what appears to be, and once they put their hand, their thumb and their fingers around the areola, the way they're going to latch a baby and bring them together, the nipple sticks out. Or the nipple may sink in or flatten out. Then we know it's true inversion or flat nipple. So yes. And so we have a lot of tools. We have the everter that can pull out the nipple. But one main factor is that when moms, if they have flat or inverted nipples, we want babies on the breast. We want no pacifiers, no bottles, no nipple. Because if a baby gets onto the soft compressible breast, the suction the baby applies will draw out the nipple. So if we can get the babies on the breast first and consistently, that will help the moms with their perceived flat nipples or inverted nipples.
Gotcha.
So that will help. So the moment we start giving the pacifier bottles, we already have built up a challenge. Right, to get them on there.
Yeah.
And then again, pumping before, using the everter, those things will also happen.
Right.
And then they also have the Hoffman maneuver, maneuvering the nipple out. So there's other techniques that we can use if it is flat or inverted.
Nice. Okay, so there's tips, there's tricks, there's things out there that can definitely be used. So as we wrap up this conversation, what are 3 things that you would like to leave for our viewers as we wrap up?
So what are the 3 things I would like to leave for the viewers? First of all, breastfeed. I would like the viewers to plan breastfeeding out for a success. And I always say when I'm working with a client-patient interchangeable, that what is your goal? And so a lot of times moms, partners don't have any goals about breastfeeding. And it's just like, well, I heard that it's good for the baby and I just want to breastfeed. Right. So identify your goal. What is that goal? Is it for 3 months? Is it the recommendation for 6 months exclusively and then beyond? Because once you have identified your goal, you are going to work hard to stick with that, to reach that number. And if you have difficulties, the next thing is have resources. Who's going to help you on this journey? Who's going to help you when in the middle of the night at 3 o'clock or whomever? So we know normal business hours, so to speak, during the daytime, you may have on-call services, warm lines, hotline, the Heritage Birth, Healthy Start, all of those services are available for you to call for help. But know your resources. So who's going to be available during the night? And I say that's your family members who you brought to the class, brought to the group. And also who can help you in the home. Who can come to me because I can't get out. I can't drive this premature baby. I don't want to expose baby. I just had a cesarean, surgical birth. Yeah. I need help. Who can come to me? So identify your resources and make those phone calls so that you get the support that you need. And Broward County, again, has a wonderful array of supports. We connect those dots Thanks to all of the organizations involved. And then the third thing and final, use your personal family members. Do not forget about the partners. They play a valuable role in this whole arena. And I want to say, a lot of times, and even to my colleagues, because when we are talking to clients, even in the hospital, even in the WIC, even wherever we're at, sometimes we forget the partner.
Yeah.
And we go right to the mom.
Right.
Right. We forgot you was over here.
Yeah.
But we want to make sure we bring the partners in on this discussion. Absolutely. And have them repeat, have them return a demonstration on how they're going to help mom. So involve your partners. And so those are the three things that I would leave you all with to help you on your breastfeeding journey. So thank you again for having me.
Absolutely. It's so funny because, you talk about the partners. One lactation consultant told me in the hospital, she loves teaching the dads how to hand express because they're able to help the moms hand express and, putting them, in that space. But yes, but thank you so much for being here and educating us today and pointing out the support that is out there in the community. And speaking of that, as you guys know, with Parent Connection, we have a plethora of support groups out there. And then in partnership with Healthy Start, Heritage Birth Collaborative is here for all of your breastfeeding needs, right? So we have support groups the first Saturday of every month via Zoom. There's also an IBCLC that is at the Heart Center, the Community Heart Center, every Wednesday from 10:30 to 11:30 to help you with your breastfeeding needs. And Heritage Birth Collaborative, not only do they do classes, but they go out to the homes. So just like Esther mentioned, who can you have come out to your home? Heritage Birth Collaborative is there for you, alrighty? And then come on out to our postpartum groups. We have one the second Wednesday of every month at Total Pediatrics. We also have our Baby and Me on the fourth Tuesday of every month. And then don't forget, we have our Dad and Me every third Saturday at the Pompano Civic Center. So we hope to see you out there, and thank you so much for tuning in. Bye-bye now.
Bye-bye now.